Well, one of the surprises in mantle cell lymphoma is the ability of drugs that target B-cell receptor signaling pathways to have an impact on the disease. It has not really been appreciated up to now that this pathway was a driving force in mantle cell lymphomas. And we were hitting the tumors with fairly blunt weapons, ignoring that this signaling pathway, which is highly rich or a very target-rich environment, was available for use as a way to hit these cells. The recent clinical trial published on ibrutinib, which is a drug that targets the bruton tyrosine kinase, just illustrates, is not unique. I think that many other drugs that can target different components of B-cell receptor signaling pathway will potentially be of use in mantle cell lymphoma, which is great because then these drugs could potentially be even combined to more profoundly affect this complex network that supposedly maintains tissue-based mantle cell lymphoma cells living. So that is a very exciting development. I would like to see how other inhibitors that target the BCR pathway might wind up having clinical impact or not. But this is one area to watch out for. There are many different, because there are many different aspects, there's PI3 kinase signaling and AKT inhibitors and inhibitors of SYK kinase and SRC kinases. All of these could potentially be applied to the context of mantle cell lymphoma to determine whether or not, in fact, they have similar effects. And again, I think that the notion of hitting pathways extremely hard is attractive because then there is a complete suppression of all the downstream signaling mediators, which should have a powerful effect in suppressing the survival and growth of these cells.